Thanks everyone for coming today to our next in the series of emotional mental health and wellness events. Today we're having a couple of panelists with us to talk about navigating the system and how to access the systems available. We often have some programs available that help with various mental health issues, but sometimes we don't even know the programs are out there, and if we do, we don't know how to access them. So that's really our focus today. And we have with us Broderick Anderson from the Columbia Area Mental Health Center of the South Carolina Department of Mental Health. Broderick's with us for the first time, and we welcome you. It's good to see you. And then Abby Cobb is the lead social worker of Richland School District 2. Abby's well known to the congregation over time through a variety of ways that we've had interface. And when one of our committee members heard that Abby was coming, she said, "I love Abby Cobb." So we are happy and we love having both of you here today, and we're going to ask you to talk a little bit about what you do specifically and tell us any and everything you want to tell us about your work and accessing the system, and then we'll open it up for questions that folks may have. So again, welcome. Whoever wants to start. Thank you.
Thank you. Good morning.
Good morning.
Thank you so much for the the opportunity to come. Abby Cobb. I am the coordinator of social work services in Richland School District 2. My primary role is supervising our social workers in Richland 2. We have a total of 23 social workers. We're thankful for that, and that sounds like a lot, but we have a lot of schools. Our high schools and 5 out of our 7 middle schools have a full-time social worker, but then everybody else shares. So we have 20 elementary schools, so all of my staff who cover elementary schools are covering at least 2 schools as well. I am also the McKinney-Vento liaison for the district. That means it's a federal Homeless Assistance Act, and so I am responsible for setting up procedures and policies for how we identify our McKinney-Vento services how we identify our McKinney-Vento students and how we provide services to them. The same thing but for foster care. So I work very closely with state DSS, our local DSS, Child Welfare Agency, and making sure we have the appropriate policies and procedures for students who are in foster care. And then I'm over this thing called attendance. Some of y'all might have people who are coming forward to you or as a friend, to move forward with assistance, is how can we not just support them in that, but physically help them in that moment. Again, calling insurance to find out, hey, who's in network, right? And then calling around once you figure out who's in network, then you got to call around to maybe 3 to 5 different places you're going to leave a voicemail message. Then they're going to call you back. Are they going to call you back when you can answer the phone? It's right. Are y'all tired just thinking about it? And we're not in crisis. Our heartbeats aren't racing. We're not, in those moments. And so that's just one of the first things I think about as we think about how you navigate the system, is that so much of it can just really depend on that place that we're in that moment. And sometimes I think we can get frustrated when we see people who need assistance or we know it would be beneficial. But just knowing that, we get frustrated with the system where we're not in crisis, nevertheless, when we are in crisis and trying to figure out how to navigate this really complex system. So one of the ways that school social workers in particular can help with that is helping to maybe decrease the amount of searching. If you're looking for counseling services, my staff often we can't quote unquote recommend a particular organization, but we can provide several different agencies and organizations that we know have been successful in working well with our families, who have been responsive to us. Many of my staff, and we have relationships directly with organizations like Department of Mental Health, where we can serve almost as that middleman to help get connecting them with resources. So I think one thing I would just like to just really share is encouraging your families to reach out to the schools. It might not seem like it's a natural fit to reach out to a school to say, hey, you know, I'm thinking about some counseling services, or I'm wondering about what's going on with my kid, if we might need some services. But so often the school counselors, the social workers, the nurses are vast. They have so much knowledge and information about the community and how to serve kids, is we can help you navigate that. Because again, it's just such a complicated process. In Richland too, we're very thankful. We're on year 2 of this. We have a partnership with an organization called Care Solace. And Care Solace is a mental health coordination program. So they're not providing direct counseling services. It's a mental health coordination program, and it deals with the issue just of what I said, of like that coordination piece. So any Richland 2 family member, any Richland 2 staff, any Richland 2 student and their family can use Care Solace services for free. We, on behalf of a student or family, can make that referral, or they can actually go on our website and do it themselves. And they will get connected with a Care Solace caseworker, so to speak, and they will find out what insurance do you have, what kind of services are you seeking, do you have any preferences, are there a particular type of services that you're looking for, and then they will go and they will identify the agencies that meet your insurance. They will identify if agencies have an opening, not 2-3 months from now, but can likely get you an appointment within the next 2 to 3 weeks. And then with your permission, they'll go, once they do that, they'll send you a list of like 2 to 5 agencies that meet your qualifications. And if you give them permission, they'll actually call and make the first appointment for you. So this is free to Richland 2 students, our faculty, and their families. It's all the information's on our website. I thought about I should have printed out some stuff, but I can send something to Pastor Fink, and we could, I'm sure, share that. But that's a wonderful, wonderful way to really help the community. And again, we partner directly with Department of Mental Health. We have currently five school-based mental health therapists in our schools. We are working, the school-based mental health, Gary Stuckey's working to get 2 more, so we're hoping to have a total of 7 in the near future, who work directly with our students and families. So they don't have to go downtown to the clinic, they don't have to go, they can get those services right there on school campus, which is a huge help. So that's kind of like a quick summary of how we address our social emotional wellness needs of our students. So I guess I will pass it on to you now.
Thank you.
Thank you.
Good morning, everybody.
Good morning.
First of all, thank y'all for the invitation. It's a pleasure to be here. Like Abby said, we do a lot of collaboration with school districts, but I am the outreach clinician for Columbia Mental Health Center through the South Carolina Department of Mental Health. And so my actual role is to do what I'm doing right now, educate the community about the different services we provide, the different locations we have throughout Richland County as well as Fairfield County, because we serve both counties, Fairfield and Richland. Also, like I said, I'm the outreach clinician, so my office is actually embedded in Transitions Homeless Shelter. So my job is to try to educate the homeless and also engage them in treatment for those that qualify for services, as well as follow up with those that are discharged from different hospitals throughout the state. So I have patients that get discharged from Rebound Behavioral Health, which is in Lancaster, and they get discharged down to Columbia. And so it's my job to ensure their stability, make sure they get their meds, and hopefully try to transition back to their county of origin. I also collaborate with Our Gospel Mission, as well as Rapid Shelter of Columbia, which is through the city of Columbia. If y'all haven't heard of that are the little pallet houses, little small tiny houses that they advertise in Columbia, down off Calhoun Street. It's an excellent way for the homeless to get started back. It's a 90-day program minimum that they can stay there for free. And so I will go down there and screen them to see if they qualify for services. If they do, try to get them engaged. A lot of people don't know that at the mental health center, we don't just provide mental health treatment where you go see a therapist for coping skills or how to manage your anger or how to manage your symptoms, but we also have psychiatrists psychiatrist that maybe prescribes medication for you as needed. The biggest thing that is happening in our realm of treatment is how many you go to the doctor's office and they prescribe you something for blood pressure and cholesterol, and you got multiple pills, all right? Have any of you had a day that you missed your medication by accident, not like you didn't do it on purpose? Okay, so, I mean, it happens. We all human, you know, that cell phone ring and, and then you go in the car and you get down the road like, I didn't take my blood pressure medicine this morning, okay? Technology has come so now, ever since 2010, that we're pushing what we call LAI, long-acting injections. And so that is something that's beneficial to our patients, which also helps them with their recovery. Like I say, sometimes life gets us where we get going, we forget to take our pills, or we go out of town, we forget to pack enough, or we forget to pack them at all. So with the LAIs, depending on which one you prescribe, it can be from a minimum of 2 weeks to a month that medication is in your system. So that's a nurse coming, taking a 15-minute injection, putting in your arm or in your glute, and that medication works the same as your oral medication. So you don't have to remember to take the medication every day. You know, it gives you more autonomy to go to work, go to school, you know, particularly in the population we serve. So with that being said, we have various locations throughout Richland County. Like I said, we collaborate with the school district, but then we also have a child and adolescent clinic downtown on 2715 Colonial Drive in Suite 100A. But then also we have adult clinic services also on 2715 Colonial Drive, which would be in Suite 200A. So they're right next door to each other, okay? Also, what we have is what we call a young adult program, where I used to be a clinician there from 2008 to 2022. And so that's a specialized population for those that are 18 to 30. We felt that, well, my big boss now, executive director, she started a program in 2008. And it was recognizable that individuals that were 18 to 30 would fall through the cracks and would not get the treatment that they needed. And the reason why is because of the stigma that a lot of people think that when you go to the hospital, a lot of folks look at when you get out of the psychiatric hospital, they consider it the same as being in a medical hospital. And so once you got to the hospital, you know, they give you a 30-day supply of medicine, you're fine. And so that's when we found out a lot of patients between 18 and 30 didn't have the insight to know that, yeah, you got out of the hospital and you had this medicine for 30 days, but until the psychiatrist or nurse practitioner tells you to discontinue them, you're going to have to ongoing take these medications on a daily basis just to maintain your psychiatric stability in the community, okay? So that's how the long-acting injections came about, because we're trying to keep people out of the hospital and not keeping them going back and forth. Reason why is because I educate a lot, still to this day. Young lady, not trying to be funny, but I'm just going to use you as an example if you don't mind. I see her at 100% cognitive right now. I'm just meeting her, okay? I tell folks, each time that you are non-compliant with your medications and you have a psychotic episode, it's like taking a baseball bat to your brain and you're hurting yourself. And so if you go in the hospital, like I say, young lady, excuse me again, I see you at 100%, you look lovely and all today too. If you go in the hospital, sir.
Flattery will get you in.
You go in the hospital, say you're in there for 2 weeks, maybe a month. Depending on the psychotic state that you got into, you might come out, we'll give it a nice number, 82%, okay? Now with that 82%, that doesn't sound like much from 100, but you gotta look at what you're losing. She's driving here to church, she has her own house, she's able to go to the store, buy her own groceries, she's able to manage her own money, do those things right now. But when she comes out of the hospital, she might not be able to stay by herself anymore because the paranoia has increased. The focus is limited now, so if she's cooking, you got eggs or something over here cooking it and you're easily distracted. Those things don't seem too much when I say 182, but those are things that you lose gradually. Now, all of us in here are getting younger, and so our minds are diminishing a little bit as we get older. As you see, you know, remember when you was a child, grandmother, uncle, and all would always remember your birthday when you was little, but as they got older, you had to go and say, hey, grandma, you know my birthday tomorrow. So you get to that point. So that's the difference I have to explain to the patients, that you already have a chemical imbalance in your brain off the dome. The medicine is to try to help those neurons stay together so that you are able to function, go to work, go to school, live a normal life, okay? But if you don't do those things, then that's what happens. You lose those skills. And so our job is to rehabilitate you, educate you on the importance of compliance, also the negative effects of different things that you might participate in, particularly in alcohol and drugs, that can also affect and bring out more of your symptoms and diminish your cognitive skills as well. Okay, so that's what my job was at that clinic. But then also to teach the kids life skills of how to cook, how to clean, how to take a shower every day, how to brush your teeth, how to fold clothes, how to budget your money, how to go for job interviews. That's what that whole specialty clinic was for. Okay, now. A lot of people don't know that we have a dialectical behavioral therapy clinic down in Lower Richland off of Pineview Road. So it's right next to the Big DM and WCOS radio station. So we have two clinics there actually. So we have an adult clinic for the one I just described for the young adults 18-30. We have an adult clinic down there to teach the same life skills for older adults 30 and above. But then also we have the dialectical behavioral therapy that's behind that. So it's going to teach those folks that we have reoccurrences of with suicidal ideations, poor coping skills, and not being able to manage their anxiety or even borderline personality disorder. So we have that clinic down there as well that a lot of people don't know about. And then also, we think about it, we have a clinic in Fairfield, which is actually right across the street from Fairfield Central High School. It's not as big a clinic as the one down here in Columbia, but it is up there. And so we do have a school-based counselor up there that covers the schools in Fairfield County, but then also addresses the individuals in Fairfield that need mental health treatment. A lot of people ask, how can I get a loved one or a friend of mine into treatment? Well, if you go back down 2715 Colonial Drive in Suite 200B, so when you're going through and you turn next to Loretta, you're gonna go all the way around to the top, and that's where we have what we call our emergency services office. And so if you have a loved one or a friend that you're really concerned of, you can take them as walk-in 8:30 to 12 Monday through Friday to get them engaged in services. So they initially would screen them like I would do with the homeless folks. They'll screen them and determine whether they're appropriate for services with us. Also, they're taking account of fees, like I was saying, fees and those things are associated with it. So if income is a question that you're concerned about, you can talk to our building department about getting a fee for service reduction. So we are a state agency, so we cannot turn anybody down. I tell folks it's okay, you know, your mental well-being is more important than this income. As we all know, at some point in time when we leave this earth, we all still gonna have a bill here. We're still gonna have a bill here. So don't worry about the bill, let's worry about your mental stability, okay? So that's how you get started there. When you get started there, you can do the screening process. If you qualify, they'll schedule what we call an ICA, initial clinical assessment, which takes about 90 minutes to 2 hours, depending on your testimony to the therapist. From there, then they schedule what we call a PMA, a psychiatric medical assessment by a nurse practitioner or a psychiatrist. That's when you get started with getting started on your medication if you're not already started on one already. After you get started in that process, then you will be transferred to whatever age-appropriate clinic that seems fit to you. So if you're 18 to 30, you would go to the clinic young adult program off Park Lane Road. If you stay in Fairfield County, you be referred to the Fairfield County Clinic. If you stay in Lower Richland or down in the Gons Ferry area, you can be referred to the Gons Ferry area. And if you're right here in Central Midlands, you'll be referred to 2715 Colonial Drive. I tell folks, we try to accommodate your needs. We know that everybody doesn't have substantial income, everybody doesn't have substantial transportation to get there, so we try to accommodate needs. Thanks to technology and COVID, some clinicians are still providing services via telehealth. So that is an option with that as well. We recently just started a new program called the ACT program, Assertive Community Treatment. And so that is for those individuals that have repetitive hospitalizations and poor insight of the need to comply with treatment. So they actually will go out in the field and address the patient at their residence, because we try to meet them where they're at, right? Hopefully soon in the next couple of weeks, we are gonna have a new facility open up out at off Faison Drive, where Morris Village is, right behind Bryan Psychiatric Hospital. It's called CSU Crisis Stabilization Unit. It's a small unit. I think they said they're gonna be able to have at least a total of 9 admissions in there. So it's gonna be our version of the ER, because a lot of folks get referred to the ER, but the ER might not have enough beds or space for you to be treated. People might be able to get accepted into some of these hospitals like Three Rivers or Richland Springs or Baptist itself downtown. So we're making it another available resource for the community for those that need stabilization. The intended plan is no more than 14 days, but if need be, the patient will be able to stay as long as they need to get stabilized, but that's the main thing, is to get the person stabilized and get them back into the community so that they can live a normal life, okay? like I explained earlier to Ms. Willingham, I also not only do events here at churches, I also go to different community events, that's how I met Abby, throughout the county, just to spread education to different community sites. A lot of people don't know the resources. They don't know that we have a housing program. So our patients are referred to our housing coordinator who assists them in getting their own independent living, so that could be an apartment based off their income because it's collaborated through HUD. We also help people apply for their benefits for Medicaid, Medicare, as well as Social Security. I gotta finish up my training courses now because they want me to be a certified resource for the homeless so that they can get their benefits started a little faster because they don't have a definitive address, phone numbers, email, things of that nature, okay? We also are offering what we call dual diagnosis classes, and that's for individuals that have a mental illness as well as an addiction, just to try to educate them the negative effects of mood-altering substance in your recovery. A lot of folks that we find, particularly those that may have paranoid schizophrenia, bipolar, use maybe THC or alcohol as a coping skill to manage the symptoms they have of auditory or visual hallucinations so that they're suppressed and not manifested out in the open. Okay, what I have here is some of the brochures to let you know the different locations that we are across the county, also the different groups that we have. We also collaborate with Probate Court downtown, 1701 Main Street. We have a program called Mental Health Court, and it's a free program for individuals that have committed a crime that if it's approved through the solicitor's office, they can participate in this program through the probate court. What it is a one-time deal that if you successfully complete that program, whatever charges that were on your record will be expunged off your record through mental health court. Yes, ma'am. Also, since I've been working at down in transition for the last 3 years now, they also have what they call a homeless court down there that I can refer people to as well. And so if you have some type of small crime that is considered in the city of Columbia, once again, if it's approved through the solicitor's office, then you can participate in that program and those charges can be dropped as well. I didn't know that riding a bike in the city at night without a headlight and a brake light is a $250 fine until I saw somebody in homeless court, and that's why they was there to get that fine off you. So it's very beneficial and effective, and these are resources that I try to provide to the center. I also collaborate with a lot of community partners to bring resources to the center for our patients, because like I said, a lot of them are not receiving benefits. So of course y'all know, as y'all seen, the gas and the groceries have gone up. So I try to find different community partners that can provide resources as far as clothing and food to our patients so that they can maintain a stable life in the community, okay? Also, a lot of people are concerned with how to get their medication. So one of the biggest things is we have a program through Well Vista that can assist you with getting your medication for free, and they will deliver it to your house. Yes, ma'am. So that's a biggie. Also, if not available, have a lot of you heard about GoodRx? Okay, so you can download the app. It really works. It really does work. I mean, that's my biggest friend, particularly with the folks that I work with, the homeless folks. So make sure y'all use that, whether you doing it for, with us or just for yourself. You'll be surprised. A lot of people go to Walmart because Walmart have everything that the medicine is actually cheaper. But if you look on the app with the GoodRx, it'll show you what actual pharmacy has that medication for the price. So the Walgreens down the street might have your medication for $14.10. CVS might have it for $12.04. You go to Kroger, it's only $2.15. It's the same medication. It just, you might have to drive a little further away from the home, but I think going from $15 to $2 is a big difference. I think that's about 2 more gallons of gas in my car that I can make work with, okay? Also, what we do with our housing program is if those are needed, I think the young man was asking me about that, Mr. William was talking about that earlier. Through the whole housing program, we work with what we call CRCFs. And those are 24-hour days, 7 to 8 week facilities that monitor their residents. And so they provide the resources they need. So if someone has difficulty remembering to take their medication every day and not capable of managing day-to-day life, washing their clothes, feeding themselves and everything, we can refer those to those CRCFs. The administrators and the staff will make sure that the residents get their medication daily. They will make sure they get breakfast, lunch, and dinner, as well as snacks in between. They wash all their clothes. They clean up all the facilities. So, I mean, if you're looking for a way to just sit down, relax, and enjoy life, I think going to a CRCF would be a great place for you. It is a fee associated with it, but also It's a program called OSS through the state that supplements the income for that, because average person is gonna run you between $1,500–$1,600 per month to stay at that facility. But if you look at all the accommodations that you provided, you don't have to buy groceries. They're cooking for you, cleaning the facility for you. All you gotta do is be a resident and just take your medication. So those are the options with that. Also, a lot of people don't know that we have two main numbers now that are statewide, 24 hours a day, 7 days a week. We have the mobile crisis number, which is 1-833-364-2274, and I got those pamphlets over there for you. That'd be a number that you call if you have someone at your house or your neighbor or somebody experienced a psychotic or manic episode. Typically, most people call 911 because that's what we've been trained to do for all our life. It's called 911 for situation. But if you can call mobile crisis, they'll come out with an actual clinician and law enforcement and determine if the patient needs to be admitted on site. And so they actually can start the paperwork process at your residence. If need be, they can reach out to the probate court and get what we call a DO, a detention order, that gives the law enforcement permission to pick that person up and transport them to the ER for further psychiatric evaluation. Also, what we have is what we call 988, suicide prevention line. That's also 24 hours a day, 7 days a week. You can call or text that number if need be. So those are some new resources that a lot of people don't know of. Myself, I am trained to do mobile crisis, so I can start the paperwork process, what we call a part one, where I just document what I witnessed or observed, what's going on with the patient, and then present that to the actual treating doctor or nurse practitioner that follow up and finish up commitment process. Also, working with the probate court, if you have someone that you feel needs mental health treatment and they're oppositional about it, you can go down to the probate court, or you can actually go to 2715 Colonial Drive, Suite 200B, to our emergency services. And it's what we call the commitment process. So you have a blue paper, which will be your judicial for mental health, and then you have the yellow for the chemical, for those that have chemical dependence. Or you need to, you can do both. And so you fill out testimony of what you witnessed, observed. You submit it to the probate court. They'll review it. They'll schedule what we call an examination and also a probate hearing. And at that stage, if they feel that someone needs to be involuntary participant in treatment, they can be what we call quarter for mental health or chemical dependence treatment. And that can be a minimum of 3 months to up to a year or possibly 2 years. And so it'll just be monitored by the court. If you do what you're supposed to do and have tremendous compliance, which we hope you do, that court order will be dismissed automatically by itself from the day that it originated. So, in a nutshell, that's a lot that we try to provide for the community.
And you didn't look at a single note, I know.
I know, that was amazing.
Well, you know, this
isn't your first presentation?
No, sir. No, sir. This is something I have to do on standby all day, every day. Yes, sir. But if y'all got any questions for me, I'm more than willing to entertain.
What about Kershaw County? Because we have some residents.
Okay, so in Kershaw County, depending on where you're at, it should be an office in Camden. If not, then you have to go to Santee Watery, which would be in Sumter. Yes, sir. Yes, ma'am.
I have a question. I know that the governor is calling to combine Department of Mental Health with DDSN, Department of Disabilities and Social Needs, and the Department of Alcohol and
Deotis.
Deotis, yeah.
Yes, ma'am.
Just saying the whole name, since not everybody knows Deotis and DDSN and what have you. Do you know where we are in that?
Actually, my executive director sent us an email about that, how they, I think it's still being looked at in the legislative office, right?
Okay.
Yeah, but that is a concern, because we're trying to figure out if we do collaborate together, how would all that fit up under one umbrella, and like which section would cover, like DDSN covers more of autism. We primarily cover those that have like schizophrenia, bipolar, personality disorder. But yeah, that's something that they're looking at collaborating together. Yes, ma'am. But I didn't see it on the email she sent the other day. I didn't see whether it was finalized or not.
Okay, yeah, I haven't heard that.
Yes, ma'am. Yeah, but that is on the top of the discussion. We get that. I got an email this week and I got one last week about it.
Okay.
Yes, ma'am. Yes, sir.
How is the mental health court funded?
It's actually through, if I'm not mistaken, it's funded through the county government, because it's coming through Richland County probate court, and then also the center gets a certain amount of income funding from Richland County as well.
The center, you said?
Yes, sir.
How's that different from mental health court?
Well, I'm saying the income for the center comes from Richland County as well as.
I see.
Yes, sir. Mm-hmm. Yeah, I think majority of our funding comes from the county, itself. And then, the state provides a good bit of, income as well, but majority of the funding comes from the county.
So are there private funds also that go into that, or?
I'm not sure about that. You can call down to the business office if you want to, or you can call that number right there, 898-4800, they give you more detail if you like.
Insurance and stuff like that.
Mm.
So
Yeah.
if you have your private insurances.
Yeah.
Is alcohol included in that chemical dependency part?
Yes, ma'am. Yes, ma'am.
What
Yeah.
about Alzheimer's and stuff? Do y'all have any interaction with people with Alzheimer's?
With Alzheimer's? Oh, yes, sir, we do, but in that situation, you'd probably be more referred out to your private doctor. If you don't have a primary care doctor, we do a lot of referrals to Eau Claire Community Health. Yes, sir, and they also have a behavioral health program as well. Yes,
I have
ma'am.
a question for Abby.
Uh,
I don't know if we're coming back up to questions for you, Abby. For children who don't have private insurance or are not Medicaid eligible, usually it's Healthy Learners that provides them with the medical care that they need. Does Healthy Learners provide any behavioral health support, do you know?
No, they do not. So Healthy Learners is an organization that can help families who don't have insurance or they're underinsured to access medical services. No, they're not providing behavioral health. So when we have families who have or children who are underinsured or don't have insurance, really one of our primary resources is going to be Department of Mental Health.
Okay.
Because again, they are a state-supported agency and they don't have the ability to deny. To deny access, and so they do provide sliding scale. They accept Medicaid. Many private organizations don't accept Medicaid,
Yeah,
and
they
so
don't.
DMH is going to be one of our primary resources for that.
Right. And do you have Spanish language clinicians?
Yes, ma'am, we reach out and get interpreters.
Okay.
Yes, ma'am.
I wanted to mention one thing. I failed to. My speech is not as good as planned as Broderick says. He's got that down pat. I was thinking that as you brought that up. One of the other things that we offer in Richland School District 2 is we have a department called Family Intervention Services. And I am biased, but I think we have some of the best family therapists in the Midlands. We have 5 or 6 family therapists, and one is Spanish speaking, so we are able to provide bilingual services for our Spanish speaking families, which is a huge, tremendous asset to us. But we as a school district and staff can refer if students the mental health needs are impacting their success at school. And one of the wonderful things about this is that they don't bill. So it's nothing, it's free to our families. So they don't bill, regardless if a family has insurance and has the abilities to pay for it. It's a free service. The other thing is that we're not doing diagnosing. And so it's just coming in there, it's a family therapy model. So it's not a individual child model, it's a family system, so you're gonna be working with the family. But that's one thing in Richland too that most school districts don't have. We've actually had this program for close to 20 years. And we were some of the first school districts in the country to offer such services. But one thing I think is important to know, particularly as we were talking about accessing the network and how you access it all, psychiatric services are oftentimes an essential piece of even doing an assessment, so for children or for adults. And Department of Mental Health is one place that's kind of like a one-stop shop. You might not be at the same day, might not be at the same time, but it's all within one system, where if you're going to a provider for counseling services and you need a psychiatrist, they're not one and the same. And actually in the Midlands area, pediatric psychiatry services are, they are extremely challenging to find, and getting into a pediatric psychiatrist could take months and months and months. So definitely if you have an individual who's seeking and considering counseling, medication on top of counseling needs, really encourage Department of Mental Health. Accessing that is going to be far easier for our families.
Abby, do y'all do any training with any of the staff and teachers for them so that they know the key things to look out for with students? You know, we keep hearing in the news about, students going in and, shooting schools and stuff like that.
Being honest, it's not as systematic as I would love it to be, or as comprehensive as I would love it to be. There are a lot of challenges and competing things. We literally get staff 2 days a year to do training. At a district level, we get a beginning of the year, we have an in-service, and then we'll have another one in October. And so when there's rollout with there's a new program called Letters that we have to teach I think it's K through 3rd grade. And it's like I don't know, I'm not.
Science of reading.
Thank you, Deborah.
Yeah.
And so literally could take 2 of those days in 1 year. And so I say all that to say, I'm not trying to excuse it. We do, but it's just not as maybe thorough. We are doing a process, and Deborah is actually one of the reasons why this originally started in Richland too. And I don't even know if you know this, that we're doing conscious discipline district-wide.
Yes.
And so we've identified a model, I don't love to say it that way, but it's a model of really helping to understand the way that your body responds when you're in stress and what that looks like for kids if they're having a hard time. And so we are implementing that district-wide. We're on year 2 for that. So we are absolutely doing that. Please know we are. But it can take a lot to kind of understand in that moment when you're sitting in a room of 30 kids to identify that one kid.
I would encourage anybody who has nothing to do on random Tuesday evenings to go to the board meetings, because it's exactly what you're saying, Abby. Like, it makes so much sense. Oh my gosh, we should be prioritizing mental health above all else. Oh, but we also need literacy programs. Oh, and we also need internships. Oh, and we also need to be sure kids are graduating on time. Oh, and we also need to be sure, like, the laundry list of things that the school district is trying to prioritize. You can't prioritize simultaneously 19 different programs or approaches or objectives. And the more our school board members hear from us that mental emotional health is actually the underlying foundational thing, children aren't going to graduate from high school on time if they're facing multiple mental health crises. And this is not just a Richland 2 thing, so it's not that I'm criticizing Richland 2. During the pandemic, we were all told, don't worry, as soon as the kids are back in the building, we'll have wraparound services, this, that, don't worry. And it's not that people don't care about that. It's not that our site administrators or district administrators don't care. There just aren't the resources. And you think about, I don't know, Spring Valley High School has what, 2,300 kids or something like that. How are you going to fully address the mental and emotional health needs of 2,300 children simultaneously? So just anything we can do to respectfully yet assertively remind our school district leadership, both the board, the superintendent, that we as a community see mental emotional health as the most important priority.
I'd also love to piggyback off of this, that we need more professionals like school social workers, school counselors. The national recommendation ratio for school social workers is 1 to every 250. And so Spring Valley has 1 social worker to 2,300 children. And school counselors are another one. Our elementary schools, we have very big elementary schools. Killian Elementary School, just here in North Springs, we can have, our average elementary school is probably 500 to 600. We have Pontiac is over 900 children. Wow. In Pontiac Elementary School.
And it used to be like 700.
It's growing. Get used to the idea. We're gonna have to rezone. Something's gonna have to happen with that. They're building, all down Percival Road. So don't take that as I do not decide if we are rezoning. So don't. I was a joke. But having more professionals, because oftentimes a school counselor, a social worker, or psychologist, many times it's just I'm not minimizing it, but providing that extra support in school can be what prevents needing therapy later down the road. And so being able to have more resources in the schools to address what's going on with that student right then and there, oftentimes those services they're prevention and they're reacting in intervention at the same time, but can prevent something from escalating and getting further down the road. But again, if I have 1 social worker to 2,300 children, it's just not going to be feasible. And so again, another way to advocate is really encouraging those positions, that there just needs to be more of them.
I didn't want to address one thing you was talking about, Mr. Willingham. It is some organizations out there now that if you want to, you can be trained as through mental health first aid, so that you're able to identify warning signs of somebody going through psychotic episodes, and it's free. It's free training. And also, I meant to tell y'all that we also provide Dept services at Columbia Mental Health Center too.
You know, you were mentioning earlier about the ER opening up, or a facility like the ER.
Yes, sir. Crisis stabilization.
Is that gonna be open 24 hours
Yes, sir.
a day?
24 hours a day, 7 days a week.
Because mainly, you know, not to be undiplomatic, but lunatic is because of the moon. You know, and generally things that happen seem to happen late at night or
Full moon.
late in the day, and, you know, needing services. That's when you see most of these episodes occur, you
Yeah,
know,
sir.
with people sick. So, you know, I know you have a hotline that you can call.
Yes, sir.
You can take them there, you know. I mean, personally myself, I've had to take, my sister to the ER. I had to take my mother to the ER, and they would treat them, and then it would get to be like 3 or 4 o'clock in the morning to say, okay, you can take them home. Well, I'm sorry, but I can't handle them, and I can't take them home. What am I gonna do with them? I mean, you know, what do you do then? I mean, that's the thing you look at. That's kind of, you know, you're kind of stuck.
Yes, sir. And I understand that, because I had to learn that when I first started with Columbia in 2008. I actually felt guilty for removing a loved one out of somebody's house, but then I had to learn that it's for the betterment of the patient as well as the betterment of the family.
Yeah.
And sometimes, you know, you don't want to put your loved one out of the house, but if it's coming problematic for you and your house, and it's not helping them emotionally and mentally, then we have to look at what's in the best interest of the patient. And that's when we look at referring them to the CRCF, so that somebody can monitor them 24 hours a day, because at some point in time, you have to go to sleep. You can't stay up 24 hours a day, 7 days a week. At some point in time, you gotta go to sleep. And that's where you got a facility where they have 3 shifts, so somebody's always up, somebody's always there to watch and monitor the patients while they're residing there. And if any emergencies come up in the middle of the night, then that can be addressed with the facility, and they either call mobile crisis or call 911 or call 988 to make sure that that patient is addressed. Yes, ma'am.
Where did you say that the new facility?
Crisis stabilization unit. So it's gonna be Lodge 5 out at Morris Village. Morris Village is 200 Phasing Drive. So if you're coming down Farrell Road, or if you're coming down Farrell Road from this end, it'll be on your right. You'll see a sign saying G. Werber Bryan Psychiatric Hospital, and so you turn right there, and you'll follow the road all around. So you're gonna pass Bryan Psychiatric Hospital. That's the state hospital. One is state hospital. We got another one upstate, Patrick B. Harris. And you're gonna follow that road all the way around, and then you'll see where it says Morris Village on the back. The closer end would be coming up 21 Wilson Boulevard from this end, and you'll actually turn left, and you'll see the sign sitting out there on the right. It's a big brown sign sitting out there right across from Mill Lake neighborhood. If you get to the stoplight where Mill Lake Park is, you just passed. You just passed it, I promise. It's the turn right before that light. Yes, ma'am. I mean, that'd be the quick end, because when you come around the road, it'll be right there on your left.
Yes, ma'am.
So, well, I worked at Baptist. I worked in recovery, so we did ECTs and all that stuff. But we got patients who were in the ER because there were no behavioral beds. You know, and they sit there for sometimes
Days.
a week or days or whatever. We personally have a son that has major depressive disorder, and he was diagnosed at 16, suicide ideation. Well, now he's mid-30s, late 30s. So now we get to the problem where, okay, so the doctor will prescribe his meds, but you can't get into a therapist. Because I'm just telling you.
No,
there
I
are lines
look,
and lines.
I
You
believe
cannot get in, because
we
it
got-
takes months to get in. So
With
he
us?
was referred to one. We live in Kershaw,
Okay.
which
Yes.
is also another problem.
Yes, ma'am.
But, well, everything is geared to Richland. Everything's geared to,
Yeah.
you know, the big city, the whatever.
Mhm.
So, a daily basis, we walk on eggshells,
Mhm.
and it have been for years.
Mhm.
We just applied for disability. 435 days later, they said, oh, you're not eligible, even though we have all the documents, we have everything, okay?
Uh-huh.
What services are available to those kids? I mean, we pay his insurance, but psychiatrists, private psychiatrists don't take insurance. It's all out of pocket.
Yeah.
So now that we're both retired and on the fixed income, that leaves us in the lurch. Not that we wouldn't do it, because we've got, I mean, we'll always do it. What services are available for those over almost 40?
Yes, ma'am.
Who have dealt with this their whole life, and families that have dealt with it their whole life?
Well, first of all, I apologize that you haven't been able to get a therapist for your son.
Well, he had an appointment for one, but then she said, nope, I'm full.
And that was at the mental health center or
So
private?
that was, we would go to Prisma, and.
Okay, y'all went to private,
doctor,
yeah.
and we were referred, and he
Yeah.
goes to the meeting, and it's like, nope, I'm full.
Yeah, I would actually look at getting engaged with us for a therapist.
Okay.
Yes, ma'am. As far as your response about disability, of course, everybody gets denied the first
Oh, yeah,
time.
we know that.
You got 60 days to appeal.
Right.
Okay.
Just got it. Just, yeah.
Yeah, and so I would strongly encourage you to appeal that, because like I said, that's the first thing, because they might not have got all the documentation that you needed. Typically, I learned over the years, you would have to sign 13 pages of the same thing, which are release of information pages, for them to reach out to whatever providers he's been treated with to follow up and then make a decision there.
He lived in 5 states since he was diagnosed, so
Yeah.
that's part of the problem.
So, yeah,
There's also an organization called SE Able, ABLE.
Okay.
And it's not a direct service organization, but it is more of like that connection. And
Okay.
so that might be a good place to reach out to you. And I think that they might even assign like a case manager.
That's exactly what he needs. 'Cause
Yeah.
It's not just
I-
mental health.
And they're multi-state too,
Yeah.
aren't they? I think they're in other states.
I'm not certain, but I would encourage that. I just went to a presentation yesterday, and they work specifically with individuals who have disabilities, so it's a wide variety of disabilities. But that might be a good place to start.
SE able?
Yes, ma'am.
Okay, thank you.
And then also, if you need help with trying to file for your disability, SC Legal is a free organization that can assist you with that as well. And they're on the corner of Elmwood and Bull.
Thank you.
You're welcome.
And thank you
No
for
problem.
being with us today.
Yes, sir.
Abby, Broderick, we appreciate your time. Some people need to leave to
Yeah.
start going to church, the second service, and it's Scout Sunday and things.
Oh, yeah,
But,
I thought I saw Boy Scout.
you've got some
Yes,
handouts
sir.
here.
Well, actually, to be honest with you guys, I went ahead and proactively, on behalf of the Culinary Mental Health Center, I went ahead and put all the information I got on the table in these bags for y'all, so y'all can take them.
Great.
There you go, sir.
Thank you. Yeah. We appreciate it. Let's close with a word of prayer. The Lord be with you.
Also with you.
Let us pray. Lord God, we pause and give you thanks for this time together, for your servants who work in mental health and social work, who serve your community, who serve our needs in a variety of ways. We pray for our leaders to care about mental health. We pray for resources to be distributed. We pray for bureaucracies to be easier to navigate. And we pray for those in need to be helped. Thank you for this time together, for this community of faith. And may all our efforts be to your glory and to serve our sisters and brothers. In the name of Christ we pray. Amen.
Amen.
Thank you again.
Since you began.